Hey everybody, and thank you for joining us. My name is Aiden Sharon, and I am the End of Plastids Manager at EarthDay.org. Today, we'll be discussing how plastic threatens human and planetary health with three experts in the health and environmental field. To start, I would like to introduce our panelists. First off, we have Dr. Teddie Porter. She's deeply committed to climate change and planetary health education. Dr. Porter is the first Director of Planetary Health for the School of Nursing at the University of Minnesota and a Fellow in the Institute on the Environment at the university. She is a member of the Alliance of Nurses for Healthy Environments and the American Academy of Nursing Environment and Public Health Expert Panel. She is a member of the Coordinating Committee of Columbia University's Global Consortium on Climate and Health Education and the Steering Committee of the Planetary Health Alliance, PHA. She chairs Clinicians for Planetary Health for the PHA. She serves on the National Academy of Medicine's Action Collaborative on Decarbonizing the U.S. Health Sector and the Health and Medicine Division of the National Academy of Sciences, Engineering, and Medicine. Her most recent work is founding and co-leading Nursing for Planetary Health in partnership with the International Council of Nurses. Next, we have John Bjorgaard. She's a registered nurse, a certified Lean Six Sigma Black Belt, and a climate change and health consultant. She is a Doctor of Nursing Practice student at the University of Minnesota, specializing in health innovation and leadership, and has focused her studies and doctoral work on planetary health. Jo's background in nursing has given her a unique lens from which to understand the connection between human and planetary health. Jo also works as a quality improvement consultant and has worked on several climate-focused projects, including a large-scale decarbonization project for a leading academic medical center, has developed website content for leading climate organizations, and is a board member of Health Professionals for a Healthy Climate, and has provided planetary health and environmental justice guest lectures and talks at hospitals, academic institutions, webinars, and conferences internationally. Jo is passionate about educating communities about the intersections of planetary and human health, and hopes to create systematic change that inspires everyone to honor and advocate for the sustainability of our planet. Our final panelist is John Ullman. He's been in the sustainability field for over a decade, bridging the connection between purchasing and health. At Healthcare Without Harm, John oversees many of the organization's market transformation and procurement initiatives. Previously, John worked at Harvard University's Office of Sustainability, where he helped advance the university's Healthier Building Materials program. John earned a Master of Business Administration and a Master of Environmental Management degrees from Duke University, and graduated from Johns Hopkins University with a Bachelor of Science degree in Molecular and Cellular Biology. And they're all much more qualified to speak on this subject than I am. So with that, let's go ahead and get started. First up, I'd like to ask Dr. Teddie Porter, can you please explain to our audience the concept of planetary health and what your work is all about?
Sure. Before I get started, I'd like to begin with a background story. I've been a climate activist for nearly 2 decades, leading movements, testifying before the state legislature, and marching in just about every climate-related march that came along. But as a nurse, I could see the human health impacts of climate change, and I felt called to do all that I could to alleviate the future suffering. But as a nurse, I began to realize that climate change is only one of many human-caused disruptions to the Earth's natural systems, and they all impact the health of humans and all life on the planet. Other environmental disruptions that are human-caused include loss of biodiversity, destruction of our forests, overconsumption of natural resources, reckless use of water, soil, air, and water pollution, and plastic pollution, and many others. Addressing only one of these issues is not going to solve the problem. We need to get way out in front of this and change the human behaviors that are at the root cause of all of these problems. This led me to Planetary Health. Planetary Health is a solutions-oriented, which is really good, transdisciplinary field, meaning it's going to take all of us, and a social movement focused on analyzing and addressing the impacts of these human disruptions to Earth's natural systems and the impacts on human health and the health of all life. I urge people to take a look at the Planetary Health Alliance, which includes over 360 universities, NGOs, and research institutes and governments around the world, all committed to working on finding viable solutions. My new role as Director of Planetary Health at the University of Minnesota School of Nursing is bringing this to our nursing profession. In a nutshell, my role is to educate, activate, and generate hope. Thank you.
Thank you. Joe, this next question is for you and kind of talks about the uses of plastic in the healthcare industry. Can you talk about what are the most common uses of plastic materials in healthcare and what specific challenges or benefits do these plastics present?
Yeah, absolutely. Thanks for having me on today. I first want to give you a bigger picture of the environmental impacts of the healthcare sector. The U.S. healthcare sector is responsible for about 10% of total U.S. greenhouse gas emissions, and the supply chain and plastics are certainly a big contributing factor to that. There are about 5 million tons of waste generated by U.S. hospitals each year, with single-use plastics accounting for more than a quarter of this waste. And to give you an idea of how much waste 5 million tons is, it's about 450 times as heavy as the Eiffel Tower and about 6 times as heavy as the Golden Gate Bridge. There are many disposable items in healthcare. Part of the reason for this is that there are stringent infection prevention standards and industry regulations. And part is that the medical device industry transitioned to single-use items and marketed them as being safer and more convenient to use, which sometimes they are. The healthcare sector is very plastic intensive. Plastic materials include sterilization wrap, IV bags, and tubing, medication packaging, basins, pitchers, trays, gloves, and syringes. There are also many single-use plastic instruments, such as scopes, that are used once and then discarded. Alternatively to single-use items, there are reusable instruments that can be disinfected or sterilized and then are safe to reuse. There are many items that can be sterilized, like I said. However, the sterilization is energy intensive, so it does require some informed decision making to determine the smart choice. I think many healthcare systems are beginning to understand the connections between environmental degradation caused by the large amounts of waste that they produce and its implications on human health. And they are beginning to implement strategies to become more environmentally sustainable through doing things like reducing single-use plastics, transitioning to reusable supplies, and recycling plastics where appropriate.
Awesome. Thank you so much. Just a quick follow-up on that. Can you provide some context about your organization specifically and the work they're doing to address plastic in healthcare?
Yeah, absolutely. We've taken on several initiatives at our organization. One of the more successful initiatives is through analyzing our single-use instruments within the surgical and perioperative setting and transitioning those to reusable instruments that can be sterilized and are safe to use. We've also done things like eliminate plastic bags that are used for patient belongings and switched over to reusable bins that can be cleaned and then reused from patient to patient. And this has eliminated many, many plastic bags that would have otherwise ended up in the landfill. One other thing that we've done is implemented a recycling program for blue wrap, which is used to maintain sterility on sterile surgical packs and things like that.
Awesome. And you mentioned that there's concerns about the energy intensity of sterilizing these materials. Is there also a time concern, like a turnaround time with receiving these materials back to use?
There is. So it does take additional time to sterilize equipment, obviously, rather than disposing and going to just get a new instrument. So it is time and labor intensive. However, the environmental benefits are great.
Thank you so much. John, can you provide some context about your organization and the work they're doing to address plastics in healthcare?
Yep, absolutely. And I'm guessing for many people listening in today, you haven't heard of my organization, Healthcare Without Harm. So I just wanted to give you a little bit of history about our mission and vantage point, especially then as it relates to plastics. So first part, you may have heard about the Hippocratic Oath that doctors take, or the phrase, first do no harm. And the meaning of this is that healthcare sector's mandate is to prevent and cure disease. And yet the delivery of healthcare services can often inadvertently and paradoxically undermine health. And so therefore, we believe that healthcare providers have a responsibility to in turn utilize practices and procedures that don't harm people and the environment in the long run. And so with this in mind, Healthcare Without Harm is an international non-governmental organization that works to transform the healthcare worldwide so it reduces its environmental footprint, becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. And importantly, connected to Healthcare Without Harm is Practice Green Health, which is our partner network of 1,500 hospitals and health systems in the United States and Canada. And then to go back almost 27 years, the origin of Healthcare Without Harm in 1996 was first to address medical waste incineration, which was a leading cause of dioxin pollution. And dioxin can be generated from burning certain plastics. Another area of our work early on involved polyvinyl chloride, or PVC, which is widely used in medical devices such as IV bags and tubing and exam gloves. It's also typically as additives such as DHP, which themselves can be disconcerting. And so for many years, we've worked with healthcare facilities to address these potential hazards by choosing alternative products, in particular for sensitive populations like infants and neonatal intensive care units, or NICU. And then today, just to fast forward a little bit, and where we're thinking about plastics and our place within the healthcare sector, we're not just considering the chemical hazards that they pose, but we're also looking much more broadly at supply chains, the impacts on communities, and the associated greenhouse gas emissions and climate impacts stemming from petrochemicals and the production of plastics.
Thank you so much. Teddie, what are the potential long-term environmental and health impacts of plastic generated by the healthcare industry?
Well, that's a really good question, and we're still uncovering that. This whole area of the health impacts of plastics is an emerging field and an emerging area of research. So we really need to be paying attention to the data. This is what we know so far. Humans are exposed to microplastics through the food we eat, the air we breathe, and skin exposure. And microplastics have been actually found in our lungs, in our blood, and even in the umbilical cord of newborns. Over 13,000 chemicals go into the production of plastics. Health impacts that we know are related to these chemicals and supported by the data include infertility, obesity, diabetes, prostate or breast cancer, thyroid problems, and increased risk of cardiovascular disease and stroke. Obviously, we want to keep abreast of this very, very critical issue because plastics are a threat to our health.
Thank you. And on that topic, Joe, can you discuss the presence of plastics in the healthcare settings and how that might impact patient safety and the health outcomes for patients?
Yeah, absolutely. Well, these really harmful effects of plastics on human health that Dr. Potter mentioned are impacting health outcomes, and they're making people sick. There are some really amazing research available on the impacts of plastics on human health. One example is Dr. Phil Landrigan's work. He's really paving the way to study the effects of plastics on human health. So I'd implore folks who are interested or want to learn more to go and look at his work. Conversely, to the really harmful impacts of plastics, especially in the healthcare setting, where plastics play a vital role, they can be a benefit to patient safety. Probably one of the most important ways in which plastics benefit patient safety and health outcomes is through their contribution to infection control. For example, health professionals and patients use personal protective equipment like gowns and gloves as a very effective means to prevent the spread of infectious disease. Additionally, some plastics in healthcare are necessary and life-sustaining, such as IV and oxygen tubing. These are obviously beneficial uses of plastics that are saving lives. Other plastics, some are avoidable and can be eliminated, such as plastic patient belonging bags, like I mentioned earlier, and other single-use items. So really, it's about understanding which items provide a necessary benefit and which we can look at making more sustainable choices about.
I kind of have a follow-up question for both Joe and Dr. Potter on why is the plastics health effect such an emerging field? I'll pose this first to Joe and then to Teddie, because it seems like we've had plastic for 100 years now, and now we're just starting to look into the health implications on humans. Why is that, or why do you think that is? I'll pose that one to Joe.
Yeah, absolutely. So plastics really came about in the, around 1950 and have really increased over time. And as we've seen these plastics being manufactured and increased over time, we've seen more drastic human impacts on our health. And so that research has really just begun. And as the evidence base is growing, we're starting to have more understanding of that. And I'll pass it over to Teddie.
Sure, and a lot of the health impacts don't show up for a while. So if the plastics first arrived on the scene in the 1950s, it has taken several decades to start to see the health impacts that I mentioned and begin to make the connection. Also, it's not just that a plastic bag in and of itself is dangerous to us. It's when it is broken down and becomes a microplastic in our environment. That's where it really has an impact on human health. So it takes a while for all the plastic products we use to break down. Also, the burning of our plastics and incineration of our plastics, we're just beginning to recognize the impact they have on human health. So it might feel like a long time, but in geological time, we've made the connection very quickly.
Thank you so much. And John, I have a question for you. In what ways can healthcare professionals and institutions start to contribute to reducing their plastic waste and promoting more sustainable practices?
Yeah, certainly. And you heard some numbers today. Joe had shared some about the total waste impact and just how massive plastics can be as a problem. From where we come from, a lot of it's from looking at solutions through purchasing. And really, the healthcare sector has tremendous purchasing power. The global healthcare sector collectively spends over $7 trillion annually, or 10% of world GDP. In the US alone, healthcare is almost 20% of GDP. And just take one piece of that, the federal government spends $25 billion on general healthcare, drugs, medical supplies, and billions more just to facilitate their facilities, their buildings, and operations. And so if you just think about those numbers, in broad strokes, if these purchases can be directed to products that cause less harm or even simply reduce the amount of materials purchased, then the impacts can really be enormous. So certainly institutions, clinicians, staff, there's lots of roles to play within the healthcare setting where you can be making an outsized impact to reduce petrochemical use and plastic use. And as Joe said, as some examples, this could be in the form of utilizing reusable rather than single-use devices, opting for products with less packaging, seeking products with alternative materials, and those would just be some, the bigger examples, but there's many other ways to make change too. And we often refer to these types of collective efforts, from our organization as market transformation, where we're leveraging the purchasing power to work with manufacturers and suppliers, not against them, but with them in partnership to bring better options to the marketplace, where we're saying, we're going to buy millions of dollars of product X, and we're interested in a provider who can provide it a better alternative, and we're going to spend these millions of dollars on that product if you provide it to us. And so there's a great dynamic that can come into play where you're driving the marketplace forward, and we've seen that time and time again in many of our campaigns and initiatives over the years, whether it's through building materials or medical devices, we're making those changes. And importantly, it's not just the healthcare sector that would benefit. It would be other business sectors, households. If you make a broad sweeping change for a product, maybe it's carpeting, maybe it's furniture, things that are very common in healthcare facilities, but manufacturers don't want to be making two different versions for the healthcare sector and maybe households or the business sectors at large. And so it's a way to drive change that ripples through in much broader places. And with the healthcare sector's purchasing power, we're in a position to do that. And so through our campaigns, our Practice Green Health network of hospitals, and others, we've been trying to push some of that innovation and change. And it's not simply about trying to reduce plastics. There's often a business case to be made too. And on the Practice Green Health website, you can find lots of case studies and examples. One I'll just note here, which is one of our favorite, was from the Ronald Reagan UCLA Medical Center in West Los Angeles, California, where they switched to reusable isolation gowns. And while admittedly it did not stop the use of plastic, it greatly reduced it. And UCLA Health was purchasing, prior to making the change, 2.6 million disposable isolation gowns on an annual basis, and generating 234 tons of landfill waste. And by switching to reusables, they were able to have cost savings of almost $500,000 a year. We offset a lot of that waste generation. And then in times of COVID, when you have reusables and you're not having as susceptible to supply chain disruptions, that can bring some added benefit as well. And certainly, as I said, there's tons of examples I could point to. I just gave that one brief one now. You could find lots of resources on our website at our annual Clean Med conference that Healthcare Without Harm hosts every year. We had a big focus on plastics reduction this year in some of our sessions, and it was countless examples, whether it's in the operating room, outpatient settings, and in particular, where clinicians themselves were actually advocating for these changes to happen. And going back to some of the comments that Joe had said about safety and regulations, obviously we never want to do this at the expense of patient health. This is about finding better solutions that can be done. And it's just being, prioritizing, finding those better options, and then driving the change. And then the last thing I'll note about just in general sustainable procurement in the healthcare sector, which is important as we think about plastics, is it's an area of just increasing focus, because it's not just the final plastics products themselves or the disposal of them. It's also the impacts along the supply chain from producing plastics. It's the carbon footprint and scope 3 emissions associated with them. And so there's much greater scrutiny these days in looking into those areas. And that's something that our organization is also looking much more closely at too. Certainly when you're looking at greenhouse gas emissions, the supply chain, scope 3, and the carbon footprint of the product, much of that is actually in its production and through that supply chain, not actually by the time it gets to the healthcare facility and disposed. And so, all to say, if you're a healthcare professional, if you're someone listening in today in the healthcare sector or not, certainly visit our website, practicegreenhealth.org, Healthcare Without Harm at noharm.org, and there's tons of resources there. And you don't need to reinvent the wheel. There's, through our network of hospitals, successes that have been happening to reduce the use of plastics for many, many years. And so I would say start there, look at what's been done, figure out what makes the most sense for your institution based on different priorities or needs that you have, and start with those early wins, and you can build up, to do more and more over time.
You mentioned market transition, and I have little knowledge about world economies and things like that, but how long would it take for the market to start shifting towards that sustainability, to have a complete shift? Are we talking like a 10-year route, 20 years, 50 years? Can you talk about that a little bit?
Yeah, so from a market transformation perspective, I can give some tangible examples. They're not solely about reducing plastics, but they are about reducing some of the worst-in-class plastics, or trying to think about the overall impacts from different chemical hazards. And we've had convenings for instance, around flooring and carpeting, typically which can have a whole host of hazardous chemicals within them. And over the span of just a few years, we convened the major procurers of in the healthcare sector of these products. We convened the major manufacturers of commercial flooring and carpeting, and we're able to come together and show that there's a huge market demand for healthier, safer products from the healthcare sector. And the business sector responded. They saw that there was a business case to be made for that. The demand was there, and so they were able to do that for us. And so it all depends what you're prioritizing, what you're hoping to achieve. We've certainly seen impacts on the short time frame. If we're talking about plastics in the healthcare sector at large, I think it's a multi-pronged approach. And so that will take time, but there are things that you could do today, even before you get to market transformation, to say, we want, these alternative products that replace plastics. It could be switch to reusables tomorrow if you're a hospital. That doesn't need to be a long time frame. I think there's a short game, there's a long game. As we're talking about trying to reduce the amount of plastics, because they can be so pervasive and create the problems that you've heard about from the other speakers today. There's a end goal, a long-term end goal, but certainly in the short term, there's more than enough that can be done to be creative and reduce plastics in healthcare.
Awesome. Thank you. Jen, I want to follow up with you on how can the healthcare professionals educate patients about the potential risk and environmental implications of plastics in healthcare? How do we make sure the patient's knowledgeable about what might be going into their body, unexpectedly?
Yeah, we should certainly talk to patients about the risks and implications of plastics. However, I think this needs to be included in a larger conversation that we should have with all patients, and that is a conversation around planetary health. This is important, and it's a lens from which to provide education to patients so that they understand those larger implications of human behaviors, plastic manufacturing and use being one of them, on our health and on the health of our planet. We can start this conversation with patients with curiosity. So as nurses, we ask patients questions about their environments and lifestyles all the time. We can expand on this and ask them about their risks of experiencing climate-related events such as wildfires and hurricanes. And this might simply be done by talking about where they live. And if they live in a high-risk area, we can educate them on preventative health measures. For example, they might be experiencing air pollution due to wildfire smoke, and we can then talk to them about wearing a mask, closing their windows, and minimizing their exposure. Similarly, we can provide conversational education by asking questions about patients' habits with plastic use. We can discuss proper disposal and recycling and ways to minimize the use of plastic, such as bringing their own reusable water bottles and cloth belonging bags when they do come to the hospital. As we begin to have these conversations and connect the dots on the implications of plastics on human health, I think we'll really see patients asking for change, which is very influential, possibly the most influential change agent, as the voice of the customer or the voice of the patient in this case is the key driver of performance and services for businesses, including healthcare. In talking about educating patients, I also want to mention the importance of educating health professionals, including nurses and doctors. Even before we can broadly educate all patients in the healthcare setting, we need to ensure that the health educators, such as the nurses and doctors, have a solid understanding of the impacts of plastics on the environment and on human health. So some ways in which this can be done is through integrating planetary health into nursing and medical school curriculum, which Dr. Potter is really doing an incredible job at. There's also the Planetary Health Education Framework that provides a framework for educating all people on planetary health. But then we also need to work on educating our current workforce. And some ways that we can do this are engaging them through green initiatives and green teams, developing annual learning lessons on planetary health concepts, including plastic pollution, and organizing webinars and learning events such as this one, and potentially offering the incentive of continued education credits for health professionals. Thanks.
Generally, how often does the topic of climate health become a discussion in your schooling? I went to school for biology and environmental science, so climate was brought up pretty constantly when you're talking about biodiversity and things. But in terms of your schooling, how often did you discuss climate health?
Yeah, I think I'm really fortunate to be a student at a school that is working really hard to integrate planetary health into their curriculum across all professions, but especially for nurses and health professionals. And so we talk about it fairly frequently, especially in my program of study and in the way that I have specialized my program. But I don't think this is the case across all education institutions. And so we really need to work on integrating this into education curriculums across all settings.
And Dr. Potter, you might have a little bit more insight into that. And how difficult can it be to implement that education perspective to more schools? Joe was saying she was fortunate, but I know a lot of schools don't have that same curriculum.
I think what's often listed as a challenge of there's not enough time, the curriculum's already packed full, we can't squeeze in one more thing, is really a false statement. In that all you have to do is work it into our clinical examples. So if you're talking about somebody with an asthma condition, you can use the story of right now we have wildfire smoke coming down from Canada, which is due to our the impact of climate change. And so we're going to be seeing worsening conditions for our patients, even though the fires are not occurring in our own location. So you can thread this in very careful, very consistently throughout our curriculum and give people an awareness for the context in which we're practicing. We're going to be, the students being educated today are going to be practicing in a climate changed world. And what we're facing with the faculty and administrators is they oftentimes went to school before climate change was an issue. So they need to be educated before we can actually educate the students. We're working on it. We're trying to get national models out and really pushing it out through nursing organizations, medical organizations. So it's being talked about. I would say in the next 5 to 10 years, we will see it consistently discussed in our health professional schools.
Thank you. And with that, can you discuss any of the ongoing research or innovations in the development of eco-friendly or biodegradable alternatives to plastics in healthcare?
Well, sure. Certainly, we want to aim towards being a plastic-free society and break our reliance on fossil fuels. But we need, given our current lifestyles, we do need to have biodegradable options to transport and store food and liquids. And in healthcare, as you've heard, we need to be able to safely administer treatments, oxygen, and medications while controlling infections. So I am here to say that innovation can lead to improved health and positive economic impact, generating new businesses and work opportunities. So it's not a wringing our hands, doom and gloom. It's an opportunity to create some new fields for our people. Some examples are the whole area of bioplastics. These are being made from waste products from corn and other vegetables, and they're turning it into solid containers. Calcium carbonate, which is basically a rock, can be shaped or formed into plastic, what would be a substitute for plastic wrap. Actually, they're doing studies about a mushroom or mycelium-based products that hold a lot of hope for connecting things together. Mycelium, it does a beautiful job connecting our forests, and now it's being used to see if we can connect some of these organic waste materials in to form plastic substitutes. Also, there's milk-based products that are being developed. So it's very, very exciting times. Wonderful research is being done in many, many fields. Again, the deepest commitment needs to be to reduce and reuse any chance we get. And we need to if we keep our focus on keeping our people healthy as possible, we can decrease our negative impact on the earth and improve the health for future generations. So a healthy population means that we don't need a lot of these things that we've talked about today. Keep our people healthy.
Dr. Potter, can you discuss a little bit more about your initiative, the Nursing for Planetary Health, and what that organization stands for and what your goals are with it?
Absolutely. Nurses are the largest group of health professionals in the world. We are everywhere, every nation, every location. We're in healthcare organizations, hospitals, acute care. We're in schools. We're in businesses. We're in communities. We do public health. We are everywhere, and we're prevention oriented. So we are on the move, activating the global nursing population to nurse for planetary health. What does that mean? The things that Joe mentioned is how do we look at human behaviors and change human behaviors so that they move us towards health rather than the illness that we're seeing. That we recognize that we're interconnected with nature. What we do to nature, we do to humans. We're absolutely interconnected. So that those philosophies and that understanding becomes the ground of our practice. And finally, for the 21st year in a row, according to the Gallup poll, nurses are the most trusted profession. People listen to us. They trust us. They trust us to give accurate information and to not be doing it for our own self-interest, which is true. And so we can leverage that trusted voice to translate emerging science and best practices into new habits so people can move towards health and we can decrease our reliance on plastics and other fossil fuels.
Awesome. Thank you so much. And if it's okay with you all, I'd like to start taking some questions from the audience. Let's see. I think this first one, so do we have any idea of the extent of the damage microplastics could have on our health? I'll let anybody decide who wants to answer that one, who wants to take it.
I can start, and
That'd be great.
I just say that we all want these answers. We want to have it really definite. And what steps do we take, and how much damage can be done? And again, it's an emerging science, so we need to pay attention to it. We know that it's dangerous. There's no doubt in that. We know it's dangerous. What we don't know necessarily is some of the details of that and how how this is going to emerge and how it's going to impact whole populations. So really stay tuned, follow people and organizations such as John's. They're doing exceptional work in this space. Follow what they're putting forward so that we can really get out the latest information.
John, from a business perspective, what kind of monetary value does microplastics have on our health? Like, what kind of cost is associated with microplastics in our health?
I think that would be difficult to quantify at this point. As Dr. Potter said, it's an emerging field. I mean, our vantage point from Healthcare Without Harm, not just about microplastics, but chemicals of concern and some of these other areas that we're worried about. It's really about taking a precautionary approach, of following the precautionary principle, where we're not waiting for 20, 30 years, as we've said earlier, to just have these things show up and see the true harm. We know they're problematic, and we want to address that as quickly as possible and not wait to just find out how truly damaging it were. And so, from a business perspective, it's really about, there are solutions out there when you can reduce costs, where you can reduce plastics. And certainly I would encourage healthcare providers to focus on those. There could be more challenging things down the road after you achieve those, where maybe it's less about saving money, maybe it's cost neutral, or maybe there's other things that you need to work through, but the long-term benefit is great. But there's lots of low-hanging fruit to start with and can reduce plastics and hence microplastics.
What can individuals do to help push? Oh, I'm sorry, we have a different question posed up there, but I just have a quick follow-up for John on that. Is just, what can individuals do to help push the healthcare industry? I know Joe mentioned briefly that they could talk with their nurses and start driving the market, but if I'm not going directly into the hospital, what can I do?
Well, I'll approach it from a few angles. Within the hospital, just to say, there's so many, and I'm coming from the procurement angle, there's so many people that are involved in procurement. I mean, you just think about it. Food service, the actual procurement department doing the contracts, the clinicians who get to have a say in the preference for what materials we're using in the operating room or elsewhere. I mean, procurement's everywhere. And so anyone within the healthcare system really has the opportunity and the voice to potentially help move this work forward. From the individual perspective, the patient perspective, you can always ask questions. You can always be more inquisitive, understanding the materials that are being used. But I will even take it one step further as a individual purchaser myself at home. I'm very thoughtful of the things that I buy. And certainly these marketplaces are intertwined. And so if individual purchasers at home are buying healthier products, not medical devices per se necessarily, but it could be other things found in a healthcare setting, that could help move the healthcare sector, and vice versa. The healthcare sector can help make our homes healthier and so forth. And so I think there's just asking the questions, pushing the marketplace, looking for those better products. There's a lot everyone can do, no matter where you're sitting as a patient, as a provider. There's a role that we can all play.
Thanks. Let's take another question from the audience. Will the prevalence of certain diseases experience a significant rise as a result of plastic pollution? And if so, which ones can you talk about, or which specific ones do we know about? I'll first pose this to Joe and then to Dr. Potter, if that's all right.
Yeah, I can definitely start on this. So plastics, as we know, have many chemical additives that are toxic to humans. These toxins from plastics remain in our environment for a very, very long time, some forever, and are found nearly everywhere, such as our soil and our drinking water. So from a human health standpoint, these toxins can cause things like brain damage, reproductive issues. They can also cause cancer, and they disrupt the endocrine system of humans.
And Dr. Potter, what are your thoughts on, more and more diseases coming out? I know we've discussed pretty extensively how the research is pretty new, but
Right. I want to just highlight what Joe said about the endocrine system. That's our hormone system. And our hormone system is designed to keep our body in balance. And when it is disrupted, when it is not functioning the way it should, multiple disease states can take hold. Also, our immunity can go down. So we'll be watching closely the impact of all of this weighing in on our human immunity. We've just come out of a pandemic, and we understand that our general population has a greater appreciation for what happens when immunity is not as strong as it should be. So we're keeping an eye on that as you said, as the evidence emerges, because it appears there is a link to decreased immunity.
is there any other linkages between the endocrine system and human health outside of immunity?
Certainly, our fertility rates is an issue, and our reproductive status is deeply connected to this.
Thank you. We have time for a couple more questions. Given the level of research in the world and the numerous amounts of people studying plastids, in your opinion, is it more than likely that plastids will be found to cause human health problems? I know we've talked pretty extensively on it, but I guess, Dr. Potter, I'll pose this to you first.
I guess what I'm going to say is again a personal story. I had a granddaughter born in April, and the thought that she already likely has plastic circulating in her bloodstream is chilling to me. This cannot be a human healthy status to have microplastics circulating. So yes, the evidence is emerging. Yes, we're beginning to see connections, but that cannot be a good situation to have plastics in the bloodstream of our newborn children, and then the rest of their lives having a cumulative effect as we're exposed more and more to these products, these byproducts. So I suspect, as a species, we are going to be in a great deal of danger unless we get on top of this.
Now, Joe, is there a likelihood that with each next generation, will there be more plastic in their bodies? Like, am I gonna accumulate less plastic than my nephew?
Currently, we're seeing plastic manufacturing rise, not decrease. And so we're actually seeing more use of plastics. So I think with the trajectory that we're on, there is a likelihood. However, we have it within our hands to change that and minimize our exposure to plastics, stop the demand for so many plastics, and transition to other healthier options.
Thank you. Then we have time for a couple more questions. So considering the ubiquity of plastics and everything from paint to clothing to roadways and furniture, how do we encourage these manufacturers to change pace and begin moving towards healthy alternatives? John, I'll pose this question to you since you are expert on the market currently in front of us.
Mm-hmm. And it does go back to one of the earlier comments where there is, I think, a short and a long game. And the long game is, goes to this question where we need to be a beating drum of saying to the manufacturers, we want less plastics, we want better alternatives, we want to encourage innovation. We're still interested in buying your products. We want you to have better products, and we'll be there to buy them when you do. So I think that's the long game. And then in the short game, there's still plenty of that you can do to start to send some signals to show that we're actually actively changing our behavior today to, in the healthcare setting, to go to those reusables, to go to different alternative products. And so, from my vantage point, I see lots of encouragement, a lot to be optimistic about, because I've seen the successes and how much can actually change in a small amount of time. And so I do, take that to heart. And find it, the work I do every day and working with healthcare systems, working with clinicians and providers, the opportunity is there on the table, and we should try to take it. So that's what I would say to that question.
Have you seen an industry that the healthcare industry can model after in terms of sustainability and moving towards a more plastic-free world?
I would say, healthcare is in the position to be the leader. I think if we can show that we're reducing plastics where they seem so ubiquitous and they're tied to the perception of patient safety and health that you have to have these, and we can show actually you can still be having the same, great care, you can still not be making sacrifices, but reduce plastic use. If you can show that for the healthcare sector, then I think any other sector would seem like a piece of cake in many ways. And so I think it's incumbent upon us to be that leader. And many have been within the US and overseas as well.
Can I just add a story here? You're beginning to realize I love stories. I also want to call in businesses and their response, as we've mentioned, to consumer choice. So out in Berkeley, the Target store, they package things up unless you bring your own reusable, and they package in a bag that looks like it's plastic, but it's compostable. That's because their citizens chose to request this and chose to mandate that. So it is possible for businesses to be responsive to citizens who ask for these changes. And that's where we need to realize that we have quite a bit of power in our hands, the power of the pocketbook. It requires us being conscious of when we go to reach for something in the shelf, is it plastic, wrapped in lots of plastic, or is it in a paper option or a compostable option that we can purchase? All that purchasing power, like John has said, and the procurement end is a huge influence on the choices that businesses make. So I would like to just put out that word of hope that we have a lot more power than we think we do.
Thank you. Yeah, it can be a little daunting when discussing all these environmental things, but it's good to have some hope. Is there anything we can do to prevent negative health effects of microplastics that are already in our bodies? Joe, I want to pose this question to you.
Yeah, thanks. So this is really about minimizing exposure. So we want to do things like filter our drinking water, don't heat food in plastic, being mindful of our purchasing choices. So I'm especially thinking about textile purchases and our clothing. Much of our clothing is actually made of plastic. And so we want to really be mindful of those things and minimize our exposures in order to somewhat detoxify and reduce those toxins that cause negative health impacts.
Is there a specific type of filter that might work better than others, like a carbon filter or a charcoal filter, to reducing microplastics?
Yeah, there are many different types of filters. I know what we use at our home is a Berkey filter, and that does have some charcoal aspect to it. And I'm not an absolute expert on other types of filters, so if Teddie or John are, I'd allow them to weigh in here.
time for two more questions. So what is the appetite for the plastic regulation within the healthcare industry and the role of government within that? For example, in the tech industry, many are calling on the government to implement regulations that they can follow. Joe, I want to start with you on this one, and I think move to John.
Yeah, absolutely. I think we're starting to see more regulations within the healthcare industry from an environmental standpoint, not necessarily specific to plastics yet. I do know, for example, the Joint Commission is starting to recommend guidelines around reducing greenhouse gas emissions and having climate action plans and things like that. And certainly plastic pollution falls along with those things. So I think the appetite is growing, but we're still sort of at the beginning of seeing those regulations within the healthcare industry. Now, there are many infection prevention regulations which can sort of disrupt the transition to not using plastics or to using single-use plastics. So we need to also consider that when we're thinking about regulations for eliminating plastics. I'll pass it over to John.
Yeah, I would just say the opportunity is here in front of us. We don't need regulation to get these plastics out. Hospitals can act right away to start to reduce their plastics use. So I wouldn't wait. The other thing to what we said before is if you're thinking about regulations, waiting for the science to come out about the damage of microplastics or damage of some of these things, again, we don't want to wait for so long just for the regulation to try to catch up. And I would delineate between regulation for safety, as Joe was saying, and regulation from the environmental perspective and reducing plastics. And there's plenty of regulations, as we've said, on the safety front. And so that's where you're not going to completely eliminate plastics tomorrow. We all acknowledge that. But there are places from the regulatory perspective where you still can have safe, approved alternatives that reduce or lessen plastics, because certain products can be without plastics or can be reprocessed, so you're not going through single use. And so the opportunities are many. And so I think, we shouldn't have to wait for regulations to catch up.
Thank you.
I also want to add into this equation that we're in a terrible healthcare workforce shortage right now. We're projected to be thousands and thousands of nurses short in the years to come. And so we do know that our young nurses, our young people are saying, I want to work in an environmentally responsible location and setting. I want my organization to be doing something about climate change and all the other planetary health issues that we're facing. So we're going to find that health organizations who address these issues are taking action on these issues and have it built into their mission and vision on how they serve communities. They are going to find that they will be drawing the employees that they need.
Thank you. I think we have time for one more question. Is there any bacteria research that can biodegrade plastic? And then can you talk about that a little bit in details? I think they're referring to some studies or news that's come out around bacteria being able to actually decompose plastic. I'll leave this up to anybody that can answer it.
I'm not an expert in this. From the evidence that I've read, there are some forms of bacteria that can biodegrade plastic, but I'm not being an expert, I'm not able to name specific bacteria, but there is research out there.
One of the key principles of planetary health is that we begin to think in terms of systems, that we don't just solve one problem only to create additional problems over here. So it's really important when we're trying to solve some of these issues that we really look closely at the entire system and factor in unintended consequences and the impact on other aspects, because to just solve one issue and then create further issues down the line or in a whole other sector is not smart. So by people beginning to understand this systems thinking approach, we're going to be much further ahead.
And I might just jump in from a slightly different angle. So if we're talking about biodegrading plastics, the waste side, I would look way upstream and let's just not have them to begin with. Right. And can we reduce those plastics? Because to make those plastics, all those petrochemicals, all the harm that come from there. And so before we even are looking into potential solutions to address plastics, microplastics, let's do as much as we possibly can to reduce them from upstream, because we don't want to be looking for those solutions at the end of life and encourage more plastic use because we think that there's a way out at the end, because we certainly don't see that coming anytime soon.
Yeah, thank you for that. It's very important to recognize. With that, I think that is all the time we have. Is there any final messages anybody would like to discuss or talk about? No? Well, I'd like to thank you all so much for coming on today and having this discussion with me. It's been really insightful and have a better scope on what the healthcare industry and plastic looks like. So I appreciate you all.
Thank you very much.
Thank
Thank
you.
you.